The health strategy that we're investigating today is acupuncture, also known as traditional Chinese medicine. What is the background of acupuncture? Acupuncture originated over 2,000 years ago in ancient China to alleviate pain and treats all kinds of diseases. Acupuncture involves the insertion and removal of needles into the part of the body called acupoints, which are points along pathways throughout the whole body called meridians that were believed to carry the life's energy. What are the health claims to acupuncture? Claims related to acupuncture can be quite broad and generally subjective, but the overall notion is that it is supposed to relieve pain and tension. Pain relief is the most common health claim for acupuncture. This can include conditions such as back pain, tennis elbow, carpal tunnel syndrome, headaches, and many others. The benefits can be both mental and physical to the patient. It is also important to note that since acupuncture has been around for so long, the benefits will likely pile up as different techniques and instructors manipulate their practice to achieve different results that a patient may feel. Acupuncture is widely used to treat chronic pain. This may be the biggest draw, as people are constantly searching for ways to manage their chronic pain. Acupuncture points may vary, but they are believed to stimulate the central nervous system. Other commonly claimed benefits include treatment for dental pain after surgery, help with addiction, headaches, and menstrual cramps. It is also sometimes used for conditions such as fibromyalgia, a chronic disorder characterized by widespread muscle pain, fatigue, and sleep issues. Additional claims include osteoarthritis, asthma, and potential help with rehabilitation. In terms of emotional claims, reductions in anxiety, depression, and neurosis are also claimed to be benefits of acupuncture. This is a large variety of claimed health benefits, although some are more prominent than others. Most relate to pain relief and attempts to reduce anxiety and mental strain. Acupuncture may lose credibility as the number of health benefits increase. Who is acupuncture being marketed to? Acupuncture is often pursued as a secondary or last resort treatment option. Studies are shown that women are significantly more likely than men to use acupuncture. The most common reasons for seeking acupuncture include back pain, joint pain, nerve pain, insomnia, stroke rehabilitation. This identifies chronic pain sufferers and rehabilitation patients as the primary target to acupuncture. Users tend to have a bachelor's degree or higher or an annual income of $75,000 or more, suggesting that acupuncture is positioned as a premium or well-focused healthcare service for the more wealthy. Is there legitimacy to the health claim? Over several decades, researchers have been investigating the legitimacy of acupuncture treatment. There have been many theories proposed that claim that acupuncture can treat not only physical symptoms but psychological as well. Symptoms that are claimed to be affected by the treatment of acupuncture include anxiety, depression, and nausea. These theories claim that upon insertion, the acupuncture needles activate the nervous system and release neurotransmitters like serotonin, dopamine, and endorphins, as well as nerve-enhancing stimulants throughout the body. However, these theories are not entirely reputable, as there has not been sufficient evidence gathered. The legitimacy of these theories remains unproven, as there is no direct correlations that support the claims. Although longitudinal studies have been conducted to test these theories, they do not meet high standards of reliability or validity, as they cannot fully control external factors that may affect patients' mental or physical health without potentially violating ethical codes or human rights policies. In 2017 to 2022, a study on acupuncture was conducted in Munich, Germany, which tested the applicability and effectiveness of the treatment. This study tested symptoms of 184 different health conditions in different individuals and compared the results. The conclusion that was drawn from this study was that the treatment of acupuncture targeted towards certain diseases was beneficial to only 92 of the 84 conditions. The most prominent areas where the results were proven to be effective were symptoms of cancer-related disorders and diseases, menopausal depression and pains, as well as muscle soreness, tightness, and fatigue. As the researchers investigated further into the mystery of acupuncture, the quality of evidence supporting its effectiveness for physical conditions increased. However, it only increased the validity in the areas that showed prominence. The theories that supported the idea of significant change in mental and nervous health, such as anxiety, endorphin release, and nerve-stimulating neurotransmitters, were not directly addressed. However, menopausal depression was one of the only major psychological conditions that was directly affected by acupuncture therapy. What is the mechanism of action? Acupuncture is proposed to relieve pain through modulation of the nervous system at multiple levels. First, needle insertion stimulates peripheral sensory afferent fibers in the skin and muscle. This sensory input travels to the dorsal horn of the spinal cord. According to Lewis and Kenyon, acupuncture primarily acts through neurological pathways. At the spinal level, activation of large diameter sensory fibers may inhibit transmission of nociceptive signals carried by smaller fibers. According to the gate control theory, stimulation of these larger fibers activates inhibitory interneurons in the dorsal horn of the spinal cord. These interneurons suppress the activity of pain-carrying small fibers, which reduces the transmission of nociceptive signals extending to the brain and ultimately decreases the perception of pain. Beyond the spinal cord, acupuncture may activate descending inhibitory pathways from the brainstem. Areas such as the periaqueductal gray and nucleus raphe magnus are key parts of the brain's pain modulation system that send inhibitory signals to the spinal cord that reduce nociceptive neuron activity. A further proposed mechanism involves endogenous opioids. Acupuncture has been shown to increase endorphin and enkephalin levels, and blocking opioid receptors can reduce its anxiolytic effects. This indicates activation of the body's intrinsic opioid system, which then suppresses pain signaling in the spinal cord and brain. More recent research by Ren et al. Suggests neuroimaging research that shows that acupuncture can modulate functional connectivity in brain regions involved in pain processing and descending control systems. These central effects may influence how pain is perceived and regulated. In summary, the proposed mechanism includes peripheral stimulation, inhibition of pain signals at the spinal level, activation of descending brainstem pathways, the release of endogenous opioids, and modulation of central pain processing networks. Is it safe, or are there side effects? The side effects of acupuncture are mostly minor, localized, and temporary, including slight bruising or discomfort at insertion sites, with serious complications being rare when performed by trained practitioners. Possible risks include infections at insertion sites, often caused by the use of non-sterile needles or inadequate skin preparation. More critical complications like pneumothorax and lung collapsion due to needle penetration of the chest cavity have been documented, mainly with treatments near the thorax. Other infrequent complications include nerve damage, excessive bleeding, or allergic reactions to needle materials. Although acupuncture is mostly safe, serious events can occur if proper hygiene or technique is neglected. It is highly important that the acupuncturist prioritizes hygiene and maintains proper technique. Thank you for listening to our acupuncture presentation.